At first, I'm kind of a little bit struggle because they have built anti-COVID room, so it's kind of different now. Like all the anti-COVID room with the zipper, and we have to kind of adapt to the new thing. Like we have to change and do our PPE where the anti-room at before we enter the patient room. It's pretty hectic. It's pretty hectic. We have a lot of phone calls that we are unable to answer. One for the family, and we understand that they need information during that time. But when we in the COVID room, we try to limit our time so we can also help the family because they also worry about their loved one. So it's kind of try to balance like each between the patient care and the family. We have an Android phone that we try to do the FaceTime with the family at least once to have them see the patient before the patient passed. So like I said, human touch is better than just the electronic thing. So I'm kind of used to that, and now everything is electronic. It's really sad for the patient, and really sad for me, and really sad for everybody who in that situation. The toughest part is the young people, and then to talk to the parent and tell them, that the patient was not doing well. That is the tough for me. I don't usually, I usually talk to the young family about grandpa, grandma, or the age will affected me a lot, especially young patients. I mean, almost like every night that I work, it seems to be like I have to put the patient on the body bag. That was really tough for me. I don't used to do that. I will go home and I think about my family, how I'm gonna deal with it if I can't see, my son or my sister during that time. I kind of like, associate like, this is my family and even patient family, then how would I deal with it? I get really sad when I think about it. I try not to think about it, but sometimes it couldn't help it. We're human, then we have to think about it. I feel secure now that I received 2 vaccines, and all my coworkers received 2 vaccines, and then we now have enough PPE, so which has helped a lot because that's the first thing we worry about back in January. Yeah. So now vaccine and enough PPE, I feel secure to work here.